Wendell, you've written a couple of books that are related to or they tie into the structural issues that plague our system, and you started Business Leaders for Healthcare Transformation. What are some of the structural issues that you'd like to highlight that cause the problems in American healthcare?
Well, basically, it is a healthcare system that is driven by profits and, frankly, driven by greed. That became so clear to me. For 10 years while I was at CIGNA, among the things that I did was handle financial communications for the company. I had to know how the company made money, what happened to it, because I would get calls every 3 months from reporters who wanted a bit more information about the company's quarterly earnings report. And I realized that it's all about what shareholders want. And it's not just about health insurance. It is, our system has grown to be profit obsessed. Our hospitals increasingly are owned by companies that have their stock traded on the New York Stock Exchange, certainly pharmaceutical companies. So we're unique in the world. The other thing that we're unique in the world, and as Mark mentioned, our employer-based system is an accident of history, and you can say the same thing, frankly, about our entire healthcare system. Those of us who are of a certain age can remember a few decades ago when most health insurance companies operated on a nonprofit basis. That began in the Great Depression when a hospital administrator in Houston decided to try to increase occupancy at his hospital, and he came up with this idea of offering hospital insurance to people who lived in the Houston area, starting with teachers. That idea was successful. It did drive business to the hospital. It ultimately became something that other hospitals around the country decided to model. That was the beginning of the Blue Cross system. And for many years, the Blue Cross system operated as all the Blues were nonprofits. They adhered to community rating. They didn't discriminate because of race or gender or age or health status. But then, as Mark mentioned, in the 1980s, things began to change. And big insurance companies like Cigna and Aetna decided to get into the business. They saw an opportunity to make some money, and some big money. And that's what happened. And the companies that I work for, Humana and Cigna, make enormous profits. They've grown by mergers and acquisitions primarily. So that's what has happened. We have a system that we turned over to Wall Street. Every other country in the developed world had at least an effort to create a national health system. But we didn't. We had attempts. Even Franklin Roosevelt thought about it, thought it wasn't possible, or he had other things he wanted to do, and just took that off the list. Harry Truman tried it, but the American Medical Association at that time was adamantly opposed to it and torpedoed that plan. And so every effort over the years has been killed by huge special interest. And in recent decades, the special interests have pooled their money. And I used to participate in organizations that took advantage of that pooling of money to develop campaigns to keep reform from happening.